Hello, I want to talk to you today about mandible. So we're going to do 3 positions for mandible. You'll notice that my image receptor is already loaded for the upright. My tube is at 40 inches and detented. The first position that we're going to do is the PA rami. Okay, so for this one, we're going to have the patient place their forehead and nose against the board. Now with this one, we want to exit out Lisa's acanthion. So I'm just going to move this way down. Okay. And again, forehead and nose are against the board. I'm going to line up my tube here. And also I need to open this up. We are at a 10 by 12, going lengthwise. Okay, so I'm making sure that Lisa is symmetrical and right in the center. So she's lined up nicely. Again, it can be difficult if you're going back and forth between hair. Also, I just want to make sure you notice, you will see a lot of light down in your patient's back. This is normal and this is where it should be. Think about where your mandible is. It does project down when you're positioned like this. So also I'm going to toss on there left marker, and then we are set to take our exposure. So the next view for mandible, we are going to do the dreaded SMV. So hopefully for you, your patient is pretty flexible. There are some modifications you can do if your patient cannot get the vertex of their head to your image receptor, and we could talk about those in class. But for right now, we're gonna go through the SMV positioning. So Lisa, I'm gonna have you turn and face the tube. My tube's at 40 inches, and I'm detented. So you'll notice Lisa's scooting forward. This is gonna help you with the position. So she needs a little bit of space. She's going to go ahead and tip her head back and place it on the board. We don't want them right up against the board, otherwise they won't be able to really bend their neck backwards. Okay, so we are going to just make sure Lisa is nicely in the center. I'm going to place my right marker up there. So she's centered nicely. And I really like where we are. Right now, I'm going right through Lisa's gonions, and I'm centered mid-sagittal, so this is set. So the last view we're going to talk about is the axial lateral view of the mandible. Sometimes texts will refer to it as sloppy lateral, just because that's how we're going to get our patient into. It's not a true lateral. Ultimately, we want to get the mandible not superimposed on one another. So that's how we're going to do this. So for this view, I've put a 5-degree cephalic angle, so it's going up a little bit. For my patient positioning, right now, Lisa is really in a true lateral. And Lisa, go ahead and rest the top of your head against the board. So again, it's causing her not to be in a great lateral. And then also I'm going to have her rotate her chin just downward a little bit. Again, we're looking for the mandible not to be superimposed, and this is how we're going to do it. For centering, I'm going to just make sure I'm coming in right at Lisa's gonion there. I'm going to move my board down so I'm just lined up. I'm doing a right lateral, I'm tucking it in nice. I'm going to collimate, but I don't want to get too crazy with the collimation front and back, because again, her one rami is a little bit closer on the other side. Let's see. And I'm going to stop there because up at the EAM, her TMJ joint is right there, and I want to make sure that's included. Okay, and then you should be set to take your exposure.